Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni. Let's look at today's daily bulletin. Fortis Healthcare Limited announced that it has signed definitive agreements with the VPS Group for the acquisition of its Medeor hospital in Manesar, Gurugram, Haryana for an overall purchase consideration of INR 225 crore. The hospital has a potential bed capacity of 350 beds and can be operationalized in a phased manner in approx 9 months. Visionary philosopher, entrepreneur, chairman and chief orthopedic surgeon, Sparsh Hospital, Dr. Sharan Shivaraj Patil has been appointed as president of Indian Society of Hip and Knee Surgeons for the year 2023 and 24. The appointment was made at the 16th annual conference of ISHKS 2023 held at Hyderabad recently. As part of his new role, Dr. Sharan Patil will be driving the objectives of ISHKS, the national organization with the objective of improving and bettering the standards of practice of the art and science of treating hip and knee diseases. Dr. Sharan has provided surgical interventions to over 5,000 underprivileged patients and has performed over 15,000 surgeries, including 8,000 joint replacements so far. While specifying how medical teachers should act as a role model for the students, the EMRB of the NMC has directed the teachers to be empathetic and compassionate. NMC mentioned in the recent guidelines on professional responsibilities of medical teachers that the medical teachers must demonstrate empathy and compassion in their demeanor and dedication to welfare of patients, nursing staff and colleagues, and maintain professionalism at all times during their interactions.
The health department in Bihar has fixed the fee structure for MBBS courses at 5 private medical colleges for 2021 to 2026. The fee structure, which includes tuition fee and the development charges, along with all that, ranges between rupees 7.98 lakhs and rupees 15.5 lakhs. The fee structure doesn't include hostel fees, transport fees, mess charges, etc. The revised fee structure is per the state submitted by the institution to the decision-making committee. The rates cannot be increased once submitted. Institute will have to return the excess amount if taken during admission in the previous academic session. For more details, please check medicaldialogues.in. The National Consumer Disputes Redressal Commission recently held Gurugram-Based ISPAT Hospital and Andur Razak Ansari Memorial Weavers Hospital and its doctors guilty of medical negligence while providing treatment to a patient operated for removal of the gallbladder. Following the operation, the condition of the patient worsened and she ultimately died because of internal bleeding leading to cardiorespiratory failure. Previously, while considering the matter, the State Commission had exonerated the Apollo Hospital. However, now the top consumer court has noted that the doctors at ISPAT and Apollo Hospital liable for not exercising their reasonable skills and fail to provide standard of reasonable care.
Sleeve gastrectomy or SG, where about 80% of the stomach is removed, is effective for treating obesity and its complications, but it has been associated with bone loss in adolescents. In a prospective study published in the Journal of Bone and Mineral Research, imaging tests revealed that SG decreases strength and bone mineral density of the lumbar spine in adolescents and young adults. In the 12-month prospective non-randomized study, 29 adolescents and young adults with obesity underwent SG and 30 were followed without surgery. At baseline and 12 months, participants underwent computed tomography of the lumbar spine for bone assessments and magnetic resonance imaging of the abdomen and thigh for body composition assessments. Eating walnuts on a regular basis could benefit the cognitive development of adolescents and contribute to their psychological maturation. These are some of the conclusions reached by a study led by the IISPB. In this study, which has been published in the journal eClinical Medicine, 700 secondary school students between 11 and 16 years of age from 12 different high schools in Barcelona participated voluntarily. They were randomly divided into 2 groups, the control group, which received no intervention of any kind, and the experimental group, which received sachets containing 30 grams of walnut kernels, indicating to the young people who participated that they could consume them daily for a period of 6 months. A drug called teriflunomide may delay first symptoms for people whose magnetic resonance imaging scans show signs of multiple sclerosis, even though they do not yet have symptoms of the disease. The preliminary study released April 19, 2023 will be presented at the American Academy of Neurology's 75th annual meeting, being held in person in Boston and live online from April 22 to 27, 2023. Called radiologically isolated syndrome, the condition is diagnosed in people who do not have MS symptoms but who have abnormalities in the brain or spinal cord called lesions similar to those seen in MS. MS is a disease in which the body's immune system attacks myelin, the fatty white substance that insulates and protects the nerves. Symptoms of MS may include fatigue, numbness, tingling, or difficulty walking. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.